Глубоко уважаемый председатель, разрешите передать привет нашим турецким коллегам от коллег казахстанцев, солнечного Казахстана.
Dear faculty, dear colleagues, let me express my gratitude for the excellent meeting and to send the greetings to Turkish colleagues on behalf of the psychiatrists of the Republic of Kazakhstan.
И поблагодарить за великолепный прием, который вы оказываете здесь в настоящее время в этом прекрасном отеле.
And one more time to express my gratitude for being here in this hotel in Antalya.
В Республике Казахстан назрела необходимость реформирования службы психического здоровья, так как на сегодняшний день нам в основном представляем традиционной стационарной и амбулаторной помощи в специализированных психиатрических организациях.
In Kazakhstan, it's a strong need of reforming the mental health services. Nowadays, the mental health care system mainly consists of traditional inpatient and outpatient specialized psychiatric institutions.
Развитие службы психического здоровья в нашей стране будет осуществляться в рамках отраслевой программы реформирования и развития службы психического здоровья, которая рассчитана на 2014-2018 годы, в подготовке которой нам оказали методическую помощь ведущие психиатры 6 ведущих стран мира.
The development of mental health services will be carried out within the framework of sectoral program on reforming and development of mental health services in the period of 2014-2018. The methodological support and the preparation of the program was provided by the leading psychiatrists from different countries, from the main 6 countries.
Уважаемые коллеги, теперь с целью экономии времени я прошу дальнейший мой доклад озвучить моей коллеге Дарье Смирновой. Спасибо.
Professor Altynbekov asked me to present his work, so in order to be in reglement, there will be 6 focus areas or directions which Professor Altynbekov would like to discuss separately. The first direction is improving preventive measures in the field of mental health. The basis of the concept of reforming mental health services lies in the following focus areas and activities. And the first focus area is the strengthening of mental health well-being among population. The World Health Organization reports that each 4th human on the planet has or had mental health problems. According to our research conducted in collaboration with Children's Fund of UNICEF within the project on investigation of the prevalence, causes and underlying risk and protective factors in suicide and suicide attempts among children and youth in Kazakhstan, and when 2,970 students aged from 15 to 17 years old were studied, the following data were revealed. 0.1% suffer from severe anxiety disorders. 1% used drugs 3 or more times. 1% drink alcohol almost daily. 1.5% attempt to commit suicide. Suicide in the past 2 weeks. 1.6% made the suicide attempts in their lifetime. 2.5% were seriously considering the issue of early cessation of life in the past 2 weeks. 3% thought about the premature end of life in the past 2 weeks. 4.4% experienced moderate to severe depression. 24.4% engage in acts of non-suicidal self-injury. That is, at least 25% of students on the very moment of the study had this certain mental health problems. The next focus area is the ensuring the significant role of mental health. Any strategies, concepts that address to the social issues such as public health, employment, urban planning, and socio-economic development should be considered through the prism of the opportunities of having a positive or negative impact on the mental health of the population in general. So the balanced, complex, well thought out social activities have a positive impact on mental health and reduce the risk of mental health problems. And on the contrary, incompleted, ill-considered steps in the social policy may affect the mental health of certain groups of the population, and as a consequence, a variety of social consequences, including the rallies, meetings, acts of disobedience, and vandalism occur. That is, they should take into account that impact which any of areas of social policy has on the mental health of people, and in particular their potential impact of the groups of risk who develop mental disorders. The next focus area is about reducing stigmatization and discrimination of people from the groups of risk and mentally ill. Stigmatization and discrimination against people with mental health problems as relevant as ever in the Republic of Kazakhstan. Even in matters of life and death, people refuse to go to a psychiatrist. According to the data of our latest research that Professor Altynbekov already mentioned above in his talk, and which was conducted in collaboration with the Children's Fund of the UNICEF, only 4 persons out of 43 students at high risk of suicide, when the suicide attempt made 2 weeks before the interview, were later on consulted by psychiatrists, only 4 persons. In other cases, the parents categorically refused their children to be examined by the specialist because the misbeliefs such as what will people think, his ways and roads will be closed in the future for this person, and etc. The next focus area is about the prevention of preventable mental health problems and suicides. Children, youth, and the elderly are at increased risk of exposure to the social, psychological, biological, and environmental factors. Taking into account their vulnerability and needs, young people and elder people should be given the priority as a part of the mental health promotion and the prevention and treatment of mental health problems. At the same time, in the Republic of Kazakhstan, the staff and services have been organized for the work with children and adolescents, but there are serious difficulties still in professional abilities of solving problems related to the age issues. Suicidal behavior refers to the factors that impact on the demographic and socio-psychological climate in the society. So far, the death rate from the suicides in the Republic of Kazakhstan is still high, 20 per 100,000 inhabitants. This is the data of 2012. Analysis of the current state of the problem of suicide in the Republic of Kazakhstan shows that mortality from suicide in many regions exceeds even the ultra-high global standards. The foregoing issues make it necessary to create a comprehensive system of prevention of suicides in the framework of the specialized crisis and sociological service in the Republic. The next direction is the implementation of modern and effective methods of diagnosis, treatment, development of research in the field of mental health. In Kazakhstan, there is an urgent need to implement the diagnosis and treatment at the level of primary health care services. Employers of primary health care services are the first and the main professionals who are faced with the most common mental health problems. At the same time, many mental disorders are not diagnosed at this stage, Or in the case of positive diagnosis, the clinical strategy provided by the primary care physician is not correct in many cases, which leads to the severe course of mental disorders. Thus, according to the research of Professor Altynbekov, conducted regarding the application of methods of psychological autopsy, it was found that 15% of suicidants have visited the primary care institutions because of some medical conditions before they committed suicide. In the field of research and significant progress has been achieved, but some of the strategies and interventions are still not based on solid evidence that demonstrates the need for further expansion of scientific research. The key priorities in the field of research include policy analysis in the field of mental health, assessment of the impact of policy and strategy on mental health of population, assessments of mental health programs and expanding the evidence-based data for prevention measures, the new models and services and economic issues of mental health care system. The next direction, the third direction, is the strengthening and development of human resources in all sectors and industries within the modern approach to solving mental health problems. Reforming the system of mental health requires professionals to carry out the new functions and responsibilities, and in its turn requires the development of new relationships, knowledge and skills. The working practices of mental health services and other industries, such as teachers, staff responsible for issuing social benefits, churchmen, and volunteers, must be adapted to the modern standards for the provision of more effective and efficient care. The next direction, the fourth direction, is about improvement and development of the organizational structure of mental health services, its infrastructure, and the strengthening of material and technical base. The evidence and experience in many countries demonstrate the expediency of developing a network of comprehensive mental health services, which will substantially reduce the number of beds in hospitals and bed space in neuropsychiatric institutions in the social services. In this area, it is planned the organization of services to support and adapt people for different stages of life which are at risk of development mental disorders, ensuring availability of rendering qualified assistance for persons with mental health problems at all levels, ensuring the opportunity to offer effective services for people with severe mental health problems in a variety of conditions, the strengthening of the material and technical base, which was already mentioned, and organization of an effective information system regarding the mental health issues. In the Republic of Kazakhstan, within the Unified National Health System, there are specific portals created and designed to provide the patients free choice of medical organization and accessibility to health services, automated registration of discharged patients, calculation of payment of cases treated regarding the clinical and financial so-called cost groups. In order to develop the effective strategies and methods of work in the Republic of Kazakhstan, it is necessary to know the real information about the current state in the field of mental health care system and about the actions being taken on the issues. It is necessary to provide monitoring of the impact of any implementation of any new initiative. The indicators that are used should be standardized and comparable at the local, national and international levels, which will contribute to the effective planning, implementation, monitoring and evaluation of evidence-based strategies and action plans on mental health care system. So the next direction, the fifth direction, is organization of effective cooperation among different industries and sectors in mental health care system. Services to meet non-medical basic human needs are currently provided by various departments. Lack of interdepartmental collaboration and lack of coordination between services of different departments lead to poor welfare and reduce the efficiency of the services provided. There are no clinical and methodological conditions for the transition from the patient's health care system into the system of social protection, and no efficient system of rehabilitation still existed. There is no clear interaction regarding the issues of prevention of socially dangerous action provided by mentally ill. And the sixth direction is reforming, the last direction is reforming the organization of financing or funding mental health services, ensuring a fair and adequate funding. Allocation of financial resources for mental health care is still inadequate. There was failed to ensure fair distribution of finances among the regions. As a result, there are a restriction of access to services and medicines under free recipes and a lack of attention to people with mental health problems. Our analysis of funding across the regions demonstrate this situation in 2012. You can see in the slide that there is a total 2 billion national currency or 15 million United States dollars were allocated for the toll-free recipes in the Republic of Kazakhstan. On the average, 230 United States dollars are allocated for one patient who receives medication for free recipe, and this sum is exceptionally inadequate. In terms of region, this sum is around $65 in the Almaty region and $800 in the West Kazakhstan region. So the difference constitutes more than 12 times. At the same time, there was the difference from 10 to 100% revealed regarding the number of patients treated in the regimen of so-called dynamic control or dynamic observation and receiving the toll-free recipes. These data indicate the usage of different approaches in different regions of the Republic of Kazakhstan. On the average in the Republic, 46% of patients at the regimen of dynamic observation are insured with the toll-free recipes. In 2012, in the Republic of Kazakhstan, the sum of 10 million United States dollars was allocated for medicines for the inpatient needs. At the same time, the difference in the allocation of drugs per one bed day in different regions was revealed. So if on the average in the Republic of Kazakhstan, $3.9 is allocated per one bed day, the sum in a terror region is $2, and in North Kazakhstan the sum is $7, so the difference constitutes almost 3 times. In total, the cost of one bed day also varies by regions. If on the average the national cost of one bed day is $23, in a terror region there was $14, and in another region there was $40, so the difference between regions constitutes 2.7 times. So there were living examples of the situation. And now, thank you for your attention.